Good evening, ladies and gentlemen. My name is Deborah Levine, and I am your Community Engagement Officer for the City University, the Graduate School of Public Health and Health Policy. Welcome and joining us this evening for our screening of Toxic, a Black Woman's Story. Please note that this is a hybrid event, and so we have people here that are in the space with us, and also folks who are across the country who are joining us this evening. So it is really an honor and a privilege to have you here with us, both virtually and in our space. So thank you very much. Next slide. So just want to take a minute to acknowledge our partners, because without them, there would be no us tonight. We want to thank the National Black Women's HIV/AIDS Network for co-sponsoring this event and helping us secure the video this evening, YCHAC, Cultivated Community Foundation, the CUNY School of Public Health and Health Policy's Sexual Reproductive Justice Hub, which has just been launched in December and we're super excited about. Haven Midwifery, Mixie Blossom, the Northern Manhattan Perinatal Partnership, along with Sisterling Collaborative, the Sigma Gamma Rho Sorority, Kappa Sigma Alumni Chapter, Community Boards 12, 10, 9, and all of you. So thank you so much for being here this evening, and we really appreciate your support. So just give us a second for those folks who are in Zoom land. Please know that you can use the Q&A function. If you don't see it on your screen, just toggle down below and you'll see the bar will come up and you can tap in there to put your questions in. For those of you that are in the room, please see that there is a QR code on the screen, which will be prompting our polls and will also give you an opportunity to drop questions in, and you'll see them on every slide. So don't feel like, oh, I missed it, and keep going. So we have a poll. Yes. Next slide. And before we drop the poll, let me just give you what the agenda is tonight so you'll know the order of business, right? So hi, it's me, Deborah Levine. I'm your Community Engagement Officer, as you heard me say before. We're gonna screen the film together. We're gonna ask our panelists to come in and join us, and we will introduce them at that time. Then we will do a Q&A with them and then some takeaways. Agreed? Good. Next slide. So we have the poll. Okay. So why are we here this week? For those that may not be aware, this is Black Maternal Health Week. Hashtag BMHW24. So please go to Instagram, Facebook, tell folks where you are tonight. This event or this week is held annually on April 11th through the 17th. Black Maternal Health Week is a week-long campaign, and it was founded and led by the Black Mamas Matter Alliance. And if you don't know them, look them up because they have some phenomenal information. And it's really to help build awareness, activism, and really build a sense of community to really amplify our voices and really put forward the lives and experiences of Black mothers and birthing people. This year's theme is Our Bodies Still Belong to Us, Reproductive Justice Now. And I think the theme makes lots of sense. Yes, that's us. So use that theme while you're hashtagging, while you're posting. We're on Facebook, we're on Instagram. We're on LinkedIn, so please follow us and chat out to folks about the experience today. April 11th, today is International Day for Maternal Health and Rights. So know that that's where we are in the process. Next slide. Black Maternal Health nationally in 2021, the maternal mortality rates for non-Hispanic women was 69.9 deaths per thousand live births, 2.6 times the rate of non-Hispanic women. That should sit for a minute. In the US, Black women are 3 times more likely to die from a pregnancy-related cause than our counterpart white women. CDC notes that more than 80% of pregnancies related to deaths are preventable. Can I say that again? 80%. That's significant. Yeah, next slide. In the US, 29 to 44% of Black women experience postpartum depressive symptoms, which is known as PDS, yet fewer are properly identified or connected to mental health care services. Significant. Here in New York State, Black non-Hispanic women had a pregnancy-related mortality rate 5 times higher than white non-Hispanic women, 54.7 versus 11.2 deaths per 100,000 live births. And we're not sharing these statistics to scare you. We're talking about the reality. And usually we try to frame these things in the positive, but we need to know, we need folks to really understand why this information is critical, why we're taking the time to have these important conversations and uplift this conversation. Next slide, sorry. Also here in New York City, from the pregnancy-associated deaths in New York, 60% of pregnancy-associated deaths in New York City between 2016 and 2018 were preventable. This is not a third world country. We're talking about New York City and New York State. The house is on fire, y'all. These numbers are outrageous. Next slide. So I want to just give you a little inference before we start the film. It's really to explore the life of Nina, a professional African-American woman in her 2nd trimester of pregnancy. I will tell you that some of this conversation may be a bit disturbing. Good, next slide. And we want to just acknowledge that the conversation is not always an easy conversation. We want to acknowledge and encourage people that if you need to take a breath, if you need to get up and step away, there are spaces around the corner for those folks who are in Zoom land. Feel free to just sort of decompress. And we're happy to support people through that process. So we just want to acknowledge that. We also want to acknowledge at this time the women who and the birthing people who came before us who are no longer with us because of the complications that they may have experienced through the birthing process. And we just want to give them a minute to acknowledge those that are no longer here with us. Thank you.
Good evening, everyone, and welcome to tonight's event. My name is Ariel Sella Holberg-Smith, and I'm the Health Equity and Literacy Program Officer for the Harlem Health Initiative here at the CUNY School of Public Health. And it is my honor to introduce our esteemed panel for this evening, beginning with our moderator, Trinisha Williams. Trinisha Williams is a midwife and educator who currently teaches midwifery at students at SUNY Downstate and attends home birth deliveries. She's the former director of midwifery at the Brooklyn Birthing Center. In 2019, Trinisha was appointed to the board of directors of the American Association of Birth Centers as vice president. She has attended over 1,000 births in her career in hospitals, homes, and birth centers. Currently, she is working on creating Brooklyn's first midwifery-led nonprofit birthing center, Haven Midwifery Birthing Center. She is married, an aunt of 12, and a native New Yorker who resides in Brooklyn. And Trinisha, actually, if you want to take the seat at the end. Yes, that's okay. Thank you. Donna Marie Downs is a birth justice defender, community doula, and ambassador. If you want to give a little wave. And a certified lactation support counselor. She believes that she's called to do this work and has been gifted as a healer, teacher, educator, network connector, advocate, counselor, confidant, and doula. Donna has over 30 years of experience supporting children and families through parenting education workshops, teen pregnancy initiatives with ACS and DOHMH. Donna holds degrees from Bronx Community College and Herbert Lehman College. She is a new elder who loves Black people and strives to bring healing to communities of color and promote health in the Black family. Donna is a native New Yorker, born in Harlem to West Indian parents, raised in the Bronx, and currently based in Southeast Queens. She is also a single parent to 2 children. And next on our line, we have Naima Beckles. You want to give a wave? Naima is a doula coordinator for the Northern Manhattan Perinatal Partnership, a vendor of the citywide doula initiative, where she supports a team of community-based doulas who serve over 100 birthing families in Upper Manhattan and the Bronx annually. Naima is also a curriculum designer and trainer who has created several courses for birth professionals, including a course on understanding and responding to pregnancy loss, trauma, and infant death within Black communities. Naima's work as a skilled educator can be found in the SoShe app, an interactive evidence-based birth prep course that parents-to-be can take on a mobile device. Naima lends her patient leadership and advocacy style to several boards, including Lamaze International, where she is a member of the executive committee. A published author and media contributor, Naima lovingly stands alongside individuals navigating life's triumphs and difficulties. Next in our panel, we have Diamond the Doula. Diamond the Doula serves as an SMC Full Circle Doula Birth Companion in New York City, actively working with pregnant persons and partners, supporting families through the continuum of women's health. As a holistic educator with a background in maternal and infant health, she's passionate about nutrition education, currently fighting for food justice as a community gardener and herbalist at the Bronx Collab. Trained in the legacy and culture of the 20th century African-American granny midwife, a community-based, family-centered approach is foundational in her work. As a full circle doula, advocating, educating, and empowering in women's health for all ages, this includes preconception health to pregnancy, labor and delivery, postpartum care, as well as abortion and miscarriage care for the community. And last but not least, we have Jacqueline Quinones. Jacqueline Quinones has worked in the Bureau of Maternal, Infant, and Reproductive Health since 2006. Currently, she is the lead hospital coordinator at the NYC Department of Health and Mental Hygiene's Maternity Quality Improvement Network. From 2019 to present, she worked with 15 birthing facilities in NYC, providing technical assistance, resources, and support on the implementation of the NYC standards of respectful care at birth. Throughout her career, she has provided training on asthma, nutrition, breast cancer, and sexual and reproductive health for the community, healthcare providers, and students. Ms. Quiñones has also worked as a counselor for individuals who are victims of intimate partner violence and experiencing homelessness. She is also a writer, a painter, animal lover, and newsletter editor and member of Las Comadres de las Americas. And now I'll hand it over to our panel.
All right. Good evening, everybody. That was definitely a powerful movie. I've got some questions here I want to ask our panelists, and I think I'm going to start with you, Donna, if you don't mind, since you're so close to me.
Right.
The first question is, how can we address racial disparities and maternal health outcomes, particularly focusing on the experiences of Black mothers, and what strategies have been proven effective in combating these disparities? So no pressure, but you can open it up.
I think we've come a long way and still can go further with insurance, health insurance for all. If you have health insurance, you are part of the way there. Doula services, just having doula services. If you know about doula services are free under your health insurance. And another way through education.
All right, I like those three. Those are beautiful.
Education, educating our clients on their services and their rights.
All right.
Don't talk about that.
Oh, okay. Naomi, can you jump in there and tell us what you think may help to improve the strategies for Black birthing people and the disparity?
Yeah, it's a hard question. One where I think both the community has the answers, so we know what can help us. We know, and we've been very vocal in what we want. And the people who are distributing healthcare are the ones responsible to listening to us. We've all said it loud and clear. I don't know what anyone else on this panel can say or do to convey that the maternal health care crisis is not about us and our health. It is about the violence that obstetrics and hospital institutions and the history of our country has inflicted upon us. So in answering the question, what can we do? We've done it. We've said what we need. We said what we want. And it's now time for the people who hold that power to respond.
Diamond, I'm going to reach into you. I know you may have some other thoughts, maybe something different from what our other panelists sort of suggested, or maybe emulating those things. Can you tell us?
Yes, of course. So much.
Take a breath.
Already, right? It has already been said. I just want to say, listening to us, right? And not being afraid to speak up for yourself. I say, as a novice doula, a lot of times working with younger mothers, someone that maybe doesn't have that family experience and background, a lot of things are new to them, and you don't know what you don't know. And a lot of times it takes that first experience and going through it or watching someone else to understand. So some of those, disparities can look like pain and stress that we're used to. And sometimes it's okay to just tap into the next person, and just kind of figure out, is that normal? What does that normalcy look like? And just sharing that, because you don't have the answers, but you don't know if you also don't share it with other people to kind of lessen that burden. And also just to make sense of the space that you're in. You won't know and you won't receive that care if someone doesn't know that something is wrong. And as much as we think that people are mind readers and they can understand, it's okay to say I need some help. It's okay to say I'm looking for support.
So asking for help, definitely.
Yeah.
What about you, Jacqueline? Anything you want to add about how these maternal health outcomes and experiences of Black mothers could be effective to be able to change this disparity?
Yeah, I would say particularly for providers, it's important to screen around social determinants of health, making sure to coordinate resources and have referral pathways so that, the patients that they see can have all the resources needed to have a healthy outcome after pregnancy. And the other thing is, it's important to think about what somebody had said earlier in this panel, and that's about education. And learning what your human rights are in reference to birthing, during pregnancy, as well as postpartum. It's important to share with other people. If you learn the information, we have the New York City Standards for Respectful Care at Birth that talk about your human rights, sharing that with family, friends, colleagues. We've had, stories, many stories from professionals as well, just like the character we saw in the movie that talked about how they experience this respectful care. And it's important to get your stories out there, get them heard by other people, and think about how to advocate for yourself and also how to help others to advocate for themselves.
One of the things that Jacqueline pointed to was New York City's respect of your body. So I'm quite sure all the people at home that aren't present here can just go online and Google that, and you'll be able to find the 4-page pamphlet about that. But thank you for that answer. How can mental health support be integral into prenatal and postpartum care for Black mothers? And what are some effective strategies for reducing stigma and increasing access to culturally competent mental health services? I'm going to jump in a little bit to Diamond for that one first, if you don't mind.
Yes, of course. I want to piggyback on a bit of what Jackie said in addressing those social determinants of health, because it's hard to focus on the two when you're focused on the one, right? I can't get to what I need tomorrow if I can't focus on what I need today, and that can look like transportation to get to that doctor's appointment or feeding myself and my family, right? So us eliminating those barriers, kind of lessening those burdens so folks can really get to where they need to be. And that's all parts, right? Because that is my mental health. Holistically, it's like if I don't feel right, if it's all kind of jumbled up here, well, how can I take myself out of this space to get outside and get the care that I need? So just kind of creating these support systems. And I say, especially in working with pregnant folks, if you already were receiving care, it's okay to get that care again. If you had an old therapist, if you had a support system or a group that you were a part of, don't wait until it gets bad. Be proactive about receiving the help and reaching out to folks again and letting them know, like, I might not know where to go, but do you know where to go? So it's okay to just share again, to lessen those burdens for yourself and to look at others around you to really know what they need as well.
Yeah. Jacqueline, do you think you can elaborate a little bit more on how they might be able to get mental health support, which may be necessary for people to find, particularly culturally competent providers? Any thoughts?
Yeah, my program, Maternity Hospital Quality Improvement Network, we're presently working with several maternity facilities, birthing facilities here in New York City. And one of the things that we're doing is a learning collaborative with the hospitals in reference to making sure that they can expedite mental health services for patients who are pregnant. A lot of times we encourage them to talk to community and try to connect with community-based organizations that can provide the services needed for their pregnant patients. One of the things we've talked about is toxicology screening, and also in terms of mental health services, it's amazing how, when we talk to the hospitals, they talk about how long it took for a referral for a person who needed to talk to someone with TACE. And so we've been able to work with several of them to expedite that. And now, usually the turnaround is about a week before somebody's referred to mental health services and they can see somebody and talk to somebody. And one of the accomplishments to one of the hospitals that we're working with that really makes a difference has to do with trust. When you talk about stigma, we noticed that a particular nurse had a relationship established with these pregnant individuals. And it was really important for her to know them, them to know her name, for them to hear from her what concerns and share their concerns. So there was a trust factor there. And so they were more willing to access mental health services because of the established relationship. And some of her clients, or some of her patients actually were there for like their second child or their third child, but it was great to have a consistent provider there, the nurse, and the social worker working with that same individual and their family and having a good experience so that they can establish that trust.
Thank you for that. Donna, what about you? What are some keys that you would say would be helpful for reducing the stigma as well as accessing mental health services? Anything you want to sort of add in there?
As I'm thinking about this question, I'm thinking about a client of mine. When I met her, she was pregnant and in therapy. And I felt so good about that, and if that could be offered in the client's first visit during prenatal therapy services. Also, to have people who have done therapy advertise and say it's okay. You see people like me and you, and it's okay to go for therapy. Nothing's wrong with that, because you're getting off that stress, which is healthy for you in your pregnancy.
Yeah.
So educating and having an offering during first prenatal. That's what I think.
Thank you for that. What about you, Naomi?
Yeah, your question makes me think a little bit about what we saw in the film, which was depicting something that was not a mental health condition, but more of a societal condition where one person was experiencing like the brunt of that. And so in this film Toxic, what we're seeing is how weathering impacts the body, and how the body then, while being like tested by the stress of being pregnant, is also has this accumulated stress, years of stress that it also has to just work through and deal with. And then that compromises the pregnant person's health. So while this isn't a mental health condition, it is a condition that needs to be addressed, and it ought to be addressed again by like the people who are providing the healthcare services ought to be better trained and able to see that. And this film, I think, does a really good job of highlighting one day in the life. So if this is one day in the life, then what are all the other days? And then we can see what the accumulating effect has on that person. So it's not, again, the individual, but rather the society that we're operating within.
I would just jump in there and also say that it's maybe a challenge for some folks to find people who are culturally competent to give them the care. Oftentimes the mental health services are catered by others out there, and that it may be hard for you to search those folks out. But I would encourage you to keep calling your health insurance providers or agencies like yours. I don't know if we can put that in the chat for people, or you can give a shout out, Jacqueline, to your agency, so that folks can be able to identify those folks that might be able to give them care that seem culturally competent for them. Any other thoughts on that? No? Okay. How can we ensure that Black mothers receive culturally competent care, quality care, such as exams, education, prescriptions, and diagnosis, where have different experiences within the healthcare system? I'm gonna start over here this time with you, Donna. I hope you don't mind.
Okay. Can we say mandatory?
Yes, we can.
We should make it part of the prenatal. It should be mandatory.
So we want it integrated into the normal services that which are offered, and not something separate or side. That's what I hear from you.
Exactly. That's
Yeah.
it. Simple as that.
Okay.
I'm sure they could throw something else in there, but we start with that.
I would piggyback on what you're saying. So making it mandatory might mean that if your healthcare provider is a doctor, then your doctor ought to be prescribing doula care for you when you're pregnant. And like to your question, Trinisha, about how can we ensure that the care is culturally competent? Again, we can listen to people who are pregnant, and people who are pregnant will often say that, hey, I would like to be supported by someone who shares my background, who shares some of my cultural experiences. And so if that's the case, and maybe a care provider like a doctor can't meet all of those needs, then we can say, like, there are doulas, right? Doulas who can support you. There are 2 doulas in the room who are community-based doulas, at least 2 doulas in the room, who I know who are community-based doulas, who are out there supporting people in ways that are culturally competent and relevant every single day.
Yes. What about you, Diamond? Any thoughts there about how we can be able to get community-based, culturally competent care? Yeah.
Yeah. Have lots of notes, so.
Okay, great.
I'm picking.
We're here for
best
this.
one. Okay. Preparation. I say for myself as a community doula, right? In a community space that I'm working in, where we're at in the Northeast Bronx, it's not a high traffic area, right? But the need still exists. And being in this organization, literally we have things going on every day, right? Every week we have folks coming out, whether it's pantry, garden, anything going on outside at the Bronx Collab. And what does that look like? That people know this is a safe space that they can come to.
Yes.
Right. And it's like for anything. It's creating these safe spaces. And I mean of all ages. right? Because community isn't just about the pregnant persons, right? It's before that, it's the preconception care, it's the teenagers that'll walk past you, right? The young men and young women, all persons that are literally going through healthy relationships that have to understand boundaries and what that looks like, right? So in these organizations, we have to start at all levels. It's not just about when someone is pregnant. You know, it's like the same way after giving birth, you're seen after 6 weeks. 6 weeks. You know, you need help after 6 hours. You need help
True,
after
it's a
6
little
minutes.
bit
You know,
long.
what are we talking about? So just literally connecting, like on a horizontal level. You know folks that are in your neighborhood, like the local organizations collaborate. You know, you have a few dollars here, you have a few dollars here. Well, let's combine it to do something well for our community. It's really just reaching out to the folks that are already on your level, and making something happen. You know, it's not always about reaching up to see who can help you in those spaces, but also bring the folks in that you know. You know someone that recently graduated from school. You know someone that's in a new program that would love to offer their services for free, you know, or just a little bit here and there. So address those needs, address the hunger, the transportation, the child care services, offer something non-traditional, and yeah, really just assess the need and where you are in your community.
I like that, assess the need. Jacqueline, could you, yeah.
Sure, I'll speak in reference to the work that we do, which is with hospitals and providers. And one of the things that we do is provide training on the sexual reproductive justice framework.
Oh, that's helpful.
And also helping them to think about the historical oppression that has been experienced by Black and Brown people in this country and many other parts of the world, and thinking about how to interact with individuals who are their patients who have experienced oppression, and also trying to make them understand that when they're asking questions is because, you know, they're trying to establish how to take care of themselves. It's not that they're trying to question their authority as doctors. It's because it's important to establish some type of bodily autonomy about how to go about taking care of themselves. And also, we talk to providers about being supportive and listening and thinking about screening patients, whether it's during triage or other times before the provider is seen, and including that information in the electronic medical record, so that when the patient comes to the provider has some type of information already about this patient, so that they can address them with culturally competent, effective practices.
That definitely sounds very integrative and maybe even advanced for what most organizations are doing. And I appreciate you sharing that. How can community-based organizations and grassroots organizations contribute to improving maternal health? Are there individuals that should be doing this advocacy work and supporting the Black health initiatives? Diamond, you look like you have something you want to say.
Just, you know, and again, just talking about that integrated care, like we shouldn't have to go so far outside of our neighborhoods.
So we should have it local and available to those people in that community. I hear you.
Yes, that's literally it. Local is the word. We know the folks that are already there that exist. Let's just connect each other.
Yes, I hear you. What about you, Donna? What thoughts do you have?
Hospitals and CBOs need to come together so referrals can be made. What I like about what I do, I'm a doula, but I also work for a community-based organization.
So you're able to connect the dots.
Exactly.
Mm-hmm.
So when you get me as your doula, you got it made, because I got all those referral connections.
Yes.
Okay, you know, but that they need to come together.
Yeah. So we need to somehow figure out how we can go to these larger systems, such as hospitals, and try to connect them with the community-based organizations when those folks out there on the ground that are actually doing the work and not sort of feel separated from it. That's what I hear from you.
Exactly. Yes.
What about you, Jacqueline? What are your thoughts?
Yeah, one of the things that we do when we work with the hospitals is, and that we require for them to have a directory of community-based resources.
That's helpful.
That are available for their patients that come to the hospital. And we also have birth justice defenders. We have birth justice defenders in all of the 5 boroughs, and they're housed at birth justice defender hubs. birth justice defenders are community residents that we've recruited and trained on the New York City standards for respectful care at birth, as well as different respectful care strategies. And they go out in the community and also hospitals or providers or community, and they're within, they're established within community-based organizations at the 5 boroughs. And so they provide education and outreach. They go to baby showers. They can do grand rounds at hospitals. And they're also they have within their contract, because they're funded by us, to provide education and outreach about respectful care in the community in which they're housed. And so they are also able to, talk about their own stories. They've had a lot of disrespected birthing experiences themselves. And so it's an opportunity for them to tell their story. And we all know that sometimes word of mouth, right? And also talking about safety and feeling a safe space. It's best when community who had the same experience and have something in common go out and talk about respectful care and what your human rights are and how to establish that.
And I think each borough has their own birth justice defenders. So whether it's the Bronx you can also go online and find out where your local organization is. And if you yourself want to get involved to help advocate for that, there are regular folks like us who are doing the work. So what about you, Naomi? What other thoughts are you thinking about? How can we use community-based organizations and their grassroots efforts to improve Black maternal health? And what can we do to advocate for Black maternal health issues?
I take a deep breath
Yeah.
when answering that question because we do a lot in community-based organizations, and I don't want to tax the community-based organizations with doing more. So we do so much. Part of my job as a coordinator for the citywide doula initiative is to support the 25, 30 doulas on my team who are out there doing so much hands-on in the community, hands-on work. And I don't want these organizations to do more. I actually want them to do less, and I want other folks to step up. So I want to be invited on those ground rounds. I want providers to be knocking on our doors to ask, what can we learn from all of you on the ground? I don't want to tax folks who are doing so much already with what can we do more of to solve this problem that we did not create.
Yeah. So what I hear from you is we need our sort of institutions to reach back to the community organization and try to help bridge that gap and not only put it on the community to help solve the problem that they did not necessarily cause.
Exactly. What I'm calling for is a reframing. Even if we reframe this conversation around Black maternal health to what the obstetrics and neglect and mistreatment, right? Because again, we are not the ones with the problem. We don't have a problem. My body is not problematic. It's the places where I'm receiving care or I'm entrusting with my care that is problematic.
Yes. Yeah. All right. In what ways can we support families and partners of Black mothers through the transitional experiences of pregnancy, childbirth, and postpartum? Anybody want to go first?
Something I used to do years ago for a foster care agency, I did parenting classes. So if you got an ACS case, you ended up coming to me for parenting classes for 12 weeks. They would walk in mad, pissed, furious because they had to be there. And by the time 12 weeks was over, they was like, how am I going to live without you? What will I do next Tuesday? Because they knew it was a need and was making a change and difference in their lives. So education, I'm back to education again and support.
Yes. Definitely agree with that. Why don't we just go down the line?
Yeah, what I also hear and what you're saying, Deborah, I think is that you found a way to spark the joy of being a parent in the groups that you were meeting with, people who showed up with a lot of distrust, found you and the community that you created, and you did something to help shift why they were there and who they can be on the outside. And so part of what we need and ought to be remembering is that this is a very tender, delicate, special time in the lives of people. And we can't just only treat people as problematic, but also see that they have joy and they ought to be able to sit proudly in this joyful experience. And even if they are in a ACS situation where it might not be all joy, it's probably something that you can pull out from it. And it sounds like that's what you were able to do.
Yeah, like there's always a way that in which we can learn from whatever situation we may be in.
Yes, and we can learn from people's joy. We don't need to always learn from the disparities. We don't always need to learn from death and poor outcomes. There's learning in joyful experiences as well.
Yeah. All right, Diamond, what are you thinking down there?
Yes, as a full circle doula, it's been like just pressed into my brain about upholding the family unit,
Yeah.
and just valuing the individuals, right? Valuing them as a unit of parents and then the family unit. You know, a lot of times we just get stuck on the baby and we say, how's the baby? How's the baby? How's the baby? How's mom? How's dad? How y'all doing together? Right? Parents, how are you doing? Guardians, providers, whatever it is. And how are the other children doing within that household, right? So really just like sticking to the family unit and encouraging them. And for me, that starts back in pregnancy and encouraging wellness goals, right? Like, what do you have to look forward to you? Not the things that maybe you want for everyone else, but what's at least 3 things that you like to stay with.
Like your own personal goals.
Yes. What are your I am statements? What do you want now? What do you look forward to after this? Something that you can hold on to, right? It's important. And I think about even for my postpartum visits, I have a checklist of things that I want to do. Do I get to any of those things? No, because I literally come in, kick my shoes off, and I'm sitting down with mom. And she literally just wants the time to talk. It's being present. It's just showing up. You know, even as a family or friend or something, bring a meal over. Maybe they don't even want to talk to you. Don't even look at them, right? Like let them take the food out your hands, put it in the fridge, and maybe they just need a nap. It's just showing up and reminding them that they're still an individual, that they're a family, and that now they have a new addition, you know, and it's okay for you all to move forward and be well together. But we have to remember that it started with this unit and you all will ultimately be together at the end, right? The folks will come in and support you, but it's you all that will go through your day-to-day things together. So remember to just uphold that and encourage the family to be a family.
I like that, highlighting sleep, highlighting bringing food. Yes, I love those.
Shower.
And taking a shower, heard over here from Donna.
Uninterrupted.
Uninterrupted, yes.
Exactly.
What about you, Jacqueline? What other sort of pearls?
I agree with what everybody said on the panel, and there isn't much more I feel like I can add to it. But definitely, you know, showing up, being present, being supportive, you know, thinking about also what aftercare is needed and how you can support them to follow up with those visits, because that's important, especially if they're experiencing any complications after the birth. Thinking about how you can be supportive and getting them back to the provider to make sure that everything's okay, and you know, also checking back up with them. Did you go, were they attentive or were they dismissive? Because we saw that happen in the video. So I think, you know, thinking about how you can support somebody in advocating for their human rights.
Yeah.
If there's complications after birth.
And even thinking back to the video, how can we best support that birthing person after such a loss and stress and what that may mean? Yeah. Yeah. Are there any questions in the chat? Oh, go ahead.
We have a couple of questions on Zoom. The first question is from Vanessa. She asks, is it best to replace your doctor or discuss how you feel dismissed when your concerns are not being addressed?
Yes. Sorry. Yeah, I think, yes, absolutely. If you don't feel confident in your doctor and you have the ability, everyone does not have the ability depending on where you live. You might be in a rural community where there aren't many options for care, but if you do have options, yes, you are the consumer of this healthcare. You do not have to accept what you're given. I would not be here had I not fired my OB who told me that, well, I won't even go into what the offensive thing that he said to me, but I wouldn't be here if that hadn't happened. I was offended by something an OB said to me when I was pregnant 16 years ago. And I told my mother, and my mother said, fire him. And that's exactly why I sit here today as a doula and a childbirth educator and a person who works in this space, because I learned to advocate for myself, fire my provider, and find a midwife, and had the best care, not just maternal care, the best care I've ever experienced in my life from a Black midwife.
All right, go ahead.
You said earlier that Black women have said a lot of times what they needed to make the change happen, but nothing is happening. Who are you referring to? Who do we need to talk to? Who do we need to call? Who do we need to harass to make things happen?
1 second. I don't know if all our folks at home heard the question. The question is about who do we need to talk to be able to make these changes? Who do we have to talk to? Who do we have to harass? How do we make these changes? Anybody want to take that up?
I think we're all trying on some level, yeah.
Oh, we have a hand in the back. Go ahead.
You have to know who your local city council person is. You have to know who your state assembly person is. You have to know your state senator. What happens in Washington is fine, but what happens in Washington isn't going to affect you in Harlem, okay? You have to, if you're having a problem at the hospital, you don't like your doctor, talk to the administrator at the hospital. But voting is how you're going to have it accomplished. Also, knowing who's the head of the Department of Health, knowing who the mayor put in as the head of the Department of Health, the head of social services. Protesting works. They don't like it when you sit out in front of their office all day talking about they don't give quality health care. They don't, these are the things that are important. And you happen to have a new city council person here who's very, very engrossed in this community for a lot of reasons. He's someone you should bring on board. But I'm with you, harass, stalk, whatever you need to do, get on social media. A lot of them have social media platforms now. Consistently write to them, let them know. Get to know the community-based organizations in your neighborhood, like NMPP, which is on 127th Street. But there are other organizations in the O'Brien Dempsey building too that provide resources for the community. Developing relationships with CUNY, getting events going in the community, talking to people at Harlem Hospital, having some kind of health event. Also working with women in the community to get around the culture. There's stigma when it comes to, I say this, I know the color of my skin does not put me in this, but I worked here for a long time. And in the Black community, when you talk about mental health to women of color, they're like, no, I gotta lock it down. Like, I can't worry about my mental health. I have to take care of the kids. I have to make sure this gets done and that gets done. There's a stigma that comes with seeing a mental health professional. Where in my community, if you do something wrong at 2, you're seeing a psychiatrist because something might be wrong with you. Here, it's not a thing. And encouraging people to advocate for their health care, not just their maternal health, preventative health care. So that's my big mouth.
I'm totally going to agree with that, but I'm also going to add one more thing. There is something out there that a lot of people might have heard of. It's called the Earth app, and you may want to be able to document any negative experiences in hopes that they can reach back to those providers and try to change behaviors. So,
And today is Earth Day.
we have some more questions.
So I would sort of modify that approach to a non-weathering approach, because, you know, I mean, do we always all have to be Sophia and, you know, like all our lives have to fight? And the people that are left fighting are the people that are stressed out about it. So I invite all my Black brethren and sistren to adopt my approach to life, which I think is an advantage because I was born in Nigeria. And so I came here when I was 5. I'm very Black, very much in America. But I do have this sort of feeling like, listen, I'm paying you, right? So if you know Nigerians, we're obnoxious. Join us because we're your cousins. Come, right? So remember that no matter what kind of insurance you have, right? If you have Medicaid, they're still being paid. It's not free, you know, like, so that means that if you adopt an informed approach, so, you know, getting a doula, you know, connecting to reputable information, and it's hard to suss that out on the you know, on Instagram and such. But the main thing is that with an app such as Earth, you're able to really review who you're working with, because, you know, like, people will be like, oh, I'm going to get a Black OB, I'm going to get a Black woman OB. And some of those Black women OBs are agents of chaos, right? Like, they are far more harmful than any other type of OB, right? So it's a matter of informing yourself, but doing so, I invite you to do so indulgently, because you deserve it, because you deserve the best, and understanding that when you take care of yourself, you take care of your whole family. So what I'll leave you with is there's a word in my mother's native tongue, a name, it's called Nneka, which means mother is supreme. And when the mother is cared for, when the person who gave birth is cared for, everybody's okay. And if she's not, or they're not, nobody's okay. So remember that, like, you know, to understand that if you want to take care of other people, really take care of yourself and really ask for good things for yourself.
Thank you for those words. Do we have any more questions in the chat?
Lauren submitted the question that we saw in the film that Nina felt reluctant to contact her OB because her concerns were repeatedly disregarded. You've described how you teach and practice patient advocacy, something that is unfortunately needed over and over again in our healthcare system. What can you share with patients who are not under your care and feel ignored by their providers? Other than participate in your wonderful programs, what else can they do?
Go ahead. So one of the things you can do if you feel your OB is ignoring you, remind yourself, if you were the employee and you treated an employer that way, you know what would happen. So you're now the employer. There is no need to get excited, document it, and then choose the hospital you want to go to. They may not be excited to see you, but they won't turn you away in New York. And you can just say, I'm not comfortable. Because we have come to a place where women have a voice now. And doctors, listen. You don't have to come in like a storm. You can be quiet and they will listen. One of the toughest things to do as a woman is to say out loud, I'm not comfortable, because it's not encouraged. If you know a woman that's at that crossroad, just stand beside her. You don't have to come in, you know, with your Vaseline on and your earrings out. Not necessary. You don't have to show up in force. Just say what there is to say. And every doctor you interview, they don't have to kiss your feet, but you don't have to kiss theirs either. Yeah, so it's a respect. It's a mutual respect. And they're going to do what they do and say what they say. But now is the time to ask questions. You know, yes, and document, please document.
And there's another resource. I hope someone can put it in the chat. It's the New York City Sexual and Reproductive Healthcare Bill of Rights. And it outlines 11 different things that you should be able to know about in order to be the best advocate you can be for yourself. And this tool can be used to be able to help you decipher if this provider is the right one. I know it is more stress and work for us to find these other providers, but your health depends on it. Again, I'm going to say it again. Your health depends on it. All right. What's our next question in the chat? That's it? All right. Does anybody, oh, we got another hand over here. 1 second. No, be sorry.
I'm a social worker. I work with youth specific. I work specifically with youth, but about 2 years ago, I worked in the DOE. And so I've gotten to learn a lot about work-related stress,
Mm.
internalizing it and how it affects your body. So I had an experience where I had to go to the doctor. They thought I had a yeast infection, but I had to fight or stand up for myself. Found out I started getting fibroids, amongst other health issues. So my question is, as health practitioners, right, we're talking about what our clients need and all these things. Even in watching the video and seeing the microaggressions on a day-to-day basis, how do you face compassion fatigue, one? And two, how do you balance your own self-care while you're fighting for others, but also needing to have energy to fight for yourself to deal with the same issues that your clients are facing, on top of having the pressure of being the leader as the person people see as the guide, but not having someone for yourself for that support because you're the leader, you're the guy, you should know better. You should know how to take care of yourself because you're the professional. So how do you balance that if that's something that you face?
I think I'll go first because as a midwife, I do see this. And what I would say is that you have to save yourself. Just like you see on the airplanes, if you don't put your oxygen mask on first, then you're going to be on the floor and nobody's going to save you. So you have to save yourself and you have to do some self-care, some times that are best for you to step away from clients, different situations, other things kind of going on, and be able to decipher what's best for you. Sometimes I even remind my clients and people I work with, I have to remember to pay my phone bill just like you got to remember to remind me about something else. There's a lot of things on our mind, and it's not that your person can't handle it, but it's only so many things you can handle. So I need you to take time out. You hear me, take time out this week to really do something for yourself, whether it's as simple as getting a 2-minute walk in or laying across your bed and just meditating or going outside and catching some of the sun in between these clouds we get. Whatever those things are. For some folks, yes, it's going to get a massage and all these big things, but it's these small moments that you need to do for yourself, because if you're not okay, you cannot take care of any of these families that you're giving care to. Okay. Anybody else?
So
wanna comment?
last round, we, as the panelists and all of your ultimate wisdom, if you would go around and give us your last set of key takeaways, because believe it or not, it's almost time for us to end.
Let's start over here. Yeah. Jacqueline, do you mind going first?
Oh, sure.
Yeah.
I'm gonna sound like a broken record, but my key takeaway is please try to get a copy of the New York City Standards for Respectful Care at Birth. We have them available. You can call 311 posters and brochures, because these are human rights that are helpful. It's about educating and informing community about these human rights so that they can advocate for themselves. So that's my last takeaway.
Thank you. Diamond?
Yes, I'd like to add that it's never a bother to ask for what you need. Ask for what you need, ask and you shall receive. And sometimes you just have to take it, and that's okay too. Get what you need. Get what you need, because you are your biggest advocate.
I'll end on just community. So one way to practice self-care is to be in community with other people, because the community can hold you accountable, right? So having a space where you can go where there are other people who might be experiencing compassion fatigue, or there are other people who are doing community doula work, knowing that you're not doing it alone can be really energizing, and can combat some of that fatigue, and knowing that if you need to be held accountable to taking care of yourself, then you have partners who can hold you accountable.
And I guess I'll go last. My thing would be hydration. Oftentimes we are not well hydrated, and that may be affecting how your health is and your body is. And the second thing is sleep. Sleep deprivation, especially for our birthing people, our postpartum people, more sleep is needed. We do not get enough sleep. So that's where I'm going to end. I want to thank everybody for being here tonight, especially our panelists. I don't know what else.
Oh my goodness, y'all. For the folks in Zoom land, you can't see us, but we're all back here grinning and smiling and clapping hands and all of the good stuff. I want to just take this time to acknowledge the good work that all of our panelists are doing and our moderators. So please give them a round of applause. And we want to make sure that you go away feeling rejuvenated and filled, and we support you and we love you and we thank you for taking care of our sisters and our birthing people in our community, because without you, there'd be no us. So on behalf of the City University, the Graduate School of Public Health and Health Policy, I thank you all for coming here today. As you will see, we have our list up there, so please, even though this event is ending, we have more events that are coming, and our panelists, we're gonna talk them into coming back and doing another segment with us. Next slide. So just really quickly, I have to thank our sponsors again, because we couldn't have done this without their commitment. So Ms. Henry from CB9, thank you very much. We appreciate you. Ron, Sister Link, we couldn't do this without you. The National Black Women's HIV/AIDS Network, thank you very much. Dr. Turnbull, I know you're out there. YCHAC, our young women, our young folks. Thanks to them, they're out there providing support. We have Sigma Gamma Rho, we have the Haven Midwifery, we have Miss Blossom, Community Board 10, Community Board 9. Who did I miss? Oh, NMPP. Yes, right. And that stands for Northern Manhattan Perinatal Partnership. So all of these links will be dropped in, and I would be really remiss if I didn't say thank you to the School of Public Health's launching of its Sexual Reproductive Justice Hub, the first in the country, right here in the village of Collab. So you watch us, because we will be doing more. Next slide, really quickly. Here are our upcoming events. We have Narcan training. We will be coming back with Dawn to do congenital syphilis. Our cannabis equity work and will be coming up, along with working with Community Board 10 to do on 4/20, our higher education, higher learning. And then we have a really great event coming up, which is a combination of Community Boards 9, 10, 11, and 12. Harlem Hospital's Community Advisory Council will be raising the issue around mental health and talking about Harlem Hospital's outpatient services, focusing on anxiety and depression. And the good news is they just got a new midwifery program. I'm going to ask you all to follow us on social media, because Priya will get me if you all do not. If you're on LinkedIn, we're there. If you're on Instagram, we're there. If we're on Facebook, we're there. So there's no excuse for you not to follow us. You'll see also we have a community health equity bulletin. So please send us your events, send us your concerns, sign up. She's poking me saying the poll, Deborah, evaluation. Okay, you see the little square here, y'all, right? Please, for my folks in Zoom land, before you sign off, please take the little poll. It's only a few questions, but we can't figure out what the next set of workshops and trainings are unless you tell us. This school is about centering community and centering you all. So thank you and have an absolutely fabulous evening. And most of all, thank you to my team, Ariacella Holbrook-Smith, Priya Khan, and Tanisha Hicks. We couldn't do this work without them. So thank you, team. Good night, ladies and gentlemen.